once I started doing stem cells, it was just so much fun. My first patient was actually a 69-year-old gentleman who had, I guess, a lot of knee problems. And he was told in no uncertain terms that he needed bilateral knee replacement by orthopedic surgeons. So he came to me, he didn't really want the operation. So I gave him an IV infusion and I injected 1 cc into each knee. But the fun part was the next day he told me, oh, I slept through the night. I haven't slept through the night for decades because he had a rotator cuff injury that he never told me about. Oh, you have knee issue.
I have a little bit of a buggy left knee. I've got like a medial meniscus. It's kind of off and on. I did protocol on it like 3 years ago because I could like barely do anything on it. And I did, have you heard of intraosseous needling before with stem cells?
I think so.
Sean Tierney from San Diego with Matt Cook, they did that on me and that helped a lot, but it's still like a little bit buggy. And I have had it injected before since then with stem cells, and it does seem to help. So,
yeah. Okay. Yeah. I don't know if you've had Zirconia laser. Have you ever experienced it?
Not like this.
Yeah, this is pretty cool. Awesome. It's really.
It's going to attack me. It's like.
Yeah. So basically, it's a phenomenal company.
Yeah.
The FDA has only given 27 indications for laser technology, and this company has 22 of those.
Wow.
So they're really into research and development.
Amazing.
Yeah. So all kinds of indications. What I love about the laser is that I can activate the stem cells and I can activate a lot of the healing mechanisms, because even without stem cells, people are noticing tremendous benefit in all kinds of conditions. I've seen people actually waking people up from coma, just using laser, or even getting someone into remission from pancreatic cancer. I mean, there's something pretty amazing about the laser. Of course, all kinds of musculoskeletal problems, brain conditions, really great for helping the brain, but a lot of different conditions. But I just did a presentation on using laser combining with stem cells. What's really powerful is that the laser can help making the cells more viable, so make them more healthy, make them proliferate more, and also helping them to be more mobile so they can travel better. And I can also target specific organs and locations.
No way. You can like a magnet, it can draw.
Yeah, help.
That's pretty cool.
To stay in certain areas.
Wow.
So I can inject all kinds of places.
You like shove it in on my tooth and stem cells in my tooth or
we can.
Or whatever. Wow. You can do like ads for testosterone or like the brain for bringing it into the brain. No, like cross the blood-brain barrier.
Okay. So the blood-brain barrier, if you want to target your brain, what we can do is actually give you a mannitol infusion. If that's something you prefer.
Oh, interesting.
Yeah, that has neuroprotective effects on its own.
No way.
Often when people with brain conditions, we add the mannitol, so more can go into the brain. You open up the blood-brain barrier.
So the mannitol like makes the blood-brain barrier permeable?
Yeah, because there's high osmolarity. So when it goes into the cells, it shrinks the cells. So that gap junction will open up.
What if somebody does stem cells and then they like have a glass of wine that night and the blood-brain barrier is still open? Would you get?
No, the mannitol is only allowing the blood-brain barrier to be more open for about 40 minutes.
Okay.
Yeah. So
it's
we
not
want
like
to capture
the next few days. I think toxins are in your system and those can cross too. This is like a short
No,
time.
you don't have to worry about that.
Okay.
But we don't advise people to use alcohol within days of treatment. Yeah. Really, probably any time. A tiny bit. I'm not a Puritan.
I'm not much of a drinker.
Yeah. I think maybe once a week, if you drink a glass or two, I'm not going to say anything.
I usually have like a small glass of wine with dinner.
Really?
I mean, like a small glass of wine.
Yeah.
It's almost like.
But yeah, the blood-brain barrier, if you don't have any brain injury, they're pretty much intact. What's interesting for people with neurodegenerative conditions or some kind of traumatic brain injury, their blood-brain barrier is actually compromised. So it's easier. I give them stem cells for the cells to get to the brain.
And you don't necessarily need as much or any of the mannitol.
Right, correct. But we still want to do it just to open up more.
Yeah.
But what's interesting in those cases, I'll add exosomes into the mixture because the exosomes doesn't need a big space. It can cross the blood-brain barrier with no problem.
I've used exosomes intranasally before.
Yeah, we
it was
do that
incredible
for brain conditions.
My head went like clear as a bell for like 2 weeks.
Oh, that's wonderful.
It's crazy. Yeah.
Yeah. I've done that on myself because, that is my biggest asset.
Yeah. I had like 2 vials of it. And over the course of a couple of days, did 2 days in a row of exosomes. It's amazing.
Oh, okay.
Because I've used like different nootropics and smart drugs. And this was probably the most profound thing I've ever felt, like right away.
Wonderful.
Yeah.
Wow. Yeah.
Just like super clear thinking. It's crazy.
I know. There's so many things that we can do with this new cutting edge approach to medicine. I mean, it's amazing because so many conditions that are deemed fairly hopeless by conventional medicine, all of a sudden these people can come to me and I look at the pathophysiology of why they got sick, and often it can dovetail with how the stem cells work. Yeah. Because I say anytime you have raging inflammation, which everyone actually starts to accumulate inflammation as we age, and anytime you have immune dysregulation, and anytime you have tissue damage, these 3 things, stem cells fits perfectly. And that covers most of the chronic conditions. So I can't say we're treating chronic conditions, but the truth is, with my academy, I founded American Academy of Integrated Cell Therapy. I train a lot of physicians.
American Academy of Integrative Cell Therapy. You founded that?
Yes. Yeah. So we provide physician training, both online course and also in-person certification training course. And I give people hundreds of studies categorized by different organ systems and disease categories. The truth is, all around the world, the research has been very active, especially for common conditions, right? Mm-hmm. When it's not as common, it takes a lot of money to do research, then it may not be done. But there's so many common chronic conditions, from head to toe, from congestive heart failure, right? Heart attack or stroke, or all kinds of autoimmune conditions, and even infertility, all kinds of brain conditions, very tough to treat. All the brain conditions, very difficult to treat. Okay. And of course, musculoskeletal. So tremendous amount of research. And, liver, heart, lungs, so kidneys, a lot of research to back up what we're doing. So I can't claim it, but what I can offer people is these research results. So don't trust my word for it. See what scientists from around the world have found out.
Right. We kind of just jumped right in talking when you pulled this laser robot out on me. Are you comfortable to just like keep on going and have this be the lead into our podcast? Even though, folks are listening right now. We just jumped right in. But you guys, this is Joy Kong. Joy, how do you describe yourself to people? Are you a regenerative medicine physician, or like if I'm sitting next to you on an airplane, how do you introduce yourself?
Like an ex-psychiatrist turned into anti-aging doctor specializing in stem cell therapy. So, I'm board certified in 3 specialties: psychiatry, addiction medicine, and anti-aging regenerative medicine. But ever since I got introduced to stem cell therapy, that was it's like someone opened up a whole new world for you. I was just blown away by the potentials of these cells.
And you were a psychiatrist when that happened?
Yeah.
How did that happen?
Well, I love the brain. So, I didn't go into medical school thinking I was going to become a psychiatrist. That was the farthest from, what I was thinking.
Really?
I thought I was going to be, I thought I was going to be either OBGYN or a, like urologist. I don't know. Cause those are things that I touch upon. I did some volunteer work in those 2 specialties. So I was just gonna, just one of those specialties. I was just gonna pick one, but never had I thought about psychiatry. It didn't cross my mind. I didn't even think that was part of medicine. But when I actually did rotations in the 3rd year of medical school, we get the taste of every specialty. And when I was doing psychiatry, that was when I was the most excited. I was willing to stay late for work, and I was just fascinated by the disease process in the brain and of all of these behaviors that people could exhibit just from a mental health illness. So, and I also saw medications really helping. So, helping way more than neurology. I love the brain, and I actually did brain research at the Mayo Clinic before I went to medical school. Mm-hmm. But I realized how futile it seemed for neurologists when they treat patients. They're very effective at diagnosing where the location of the defect is, and that was pretty much the end of the story. And then people are left.
You mean they could tell, like a neurologist could tell you've got, I don't know, like neurofibrillary tangles or pre-Alzheimer's, or like they could tell you the anatomical or physical location, but they couldn't fix it.
Exactly. And that's a very depressing position to be in. So when urologists diagnose a particular brain condition, there's almost nothing they could offer, frankly. And that's why I thought I couldn't go into it. You can be a great detective, but then you're not really helping people. But psychiatry, you actually can. Those medications actually take people out of psychosis, take them out of mania or depression.
Are you talking about like SSRIs, like antidepressants?
SSRI, antipsychotics, mood stabilizers. They're powerful.
Yeah.
But they're powerful.
They've also gotten a bad reputation, it seems like, in many cases.
Yes. Because there are heavy duty medications with a lot of side effects.
Yeah.
And I think they're great in emergency situations when a person is about to kill themselves, hurt somebody else, or completely, doing things that are very destructive to their lives.
Yeah. Well, I heard, Tim Ferriss was talking about how he uses, and forgive me, Tim, if I get this wrong, trazodone regularly for sleep.
Yeah, it's very commonly
I tried some.
prescribed.
I felt horrible. I felt like didn't feel like myself at all. I felt like a zombie the next day. My mood was all over the place. Tried it again the next night to see if that was actually what did, and again, felt horrible.
Yeah.
Like just not myself.
Okay. Yeah. There are probably much better ways of helping sleep.
Yeah. I was more just curious, but never.
Yeah, I've written so many prescriptions of trazodone, I can't even count. But those are our toolbox. So I wasn't satisfied with the toolbox because we were not addressing the fundamental root causes of
with
people.
the medications, even
yes,
those weren't
why
addressing.
do you have bipolar disorder? Why do you have schizophrenia? Why are you depressed? So are we addressing everything in the body before just start to bombard the receptors? Because everything they talk about from this medication is receptor. We're increasing the number of neurotransmitters. We're trying to hit receptors. So they're very, in a sense, myopic. I hate to use the negative word, but it is very limited in their thinking because they think the brain is this soup of chemical or molecular interactions.
Like just modern psychiatry?
Modern psychiatry, the way they discover these drugs, that they think that all this is true. Certain receptors, neurotransmitters will produce certain effects, but why are you lacking in certain neurotransmitters?
Yeah.
Why is your receptor not responding? What is underlying that? Are you addressing those? It could be a nutritional problem.
Did you learn any of that in psychiatry, the underlying stuff, or was it all just throw medications at it?
Yeah.
Not that I want you to throw your entire former profession under the bus, but what is that going into my embodiment in a way?
We're hydrating you right now.
For those of you who want to watch the video version, it's going to be at bengreenfieldlife.com/joykong. If you're just listening to the audio, we got all some cool, juicy videos here going on. So that's just hydration going into me right now.
Yeah. Okay. And then now we're going to bleed you. We're going to take blood out of you. Yes. Right. So that we can mix it with ozone gas. So we want to incorporate these therapies because we're going to give you better results when it comes to the effect of the stem cells. So ozone is O3. And when we pass this 100% oxygen through the ozone machine, that's O2 transformed into O3. But it's only...
And you need like an ozonator to do that.
Yeah,
right?
that's an ozone machine.
Through a machine.
Right. And it only probably, we're going to get about 2% of the entire mixture that's actually ozone molecule. The rest is oxygen. So when we mix it with your blood, it's super oxygenating the blood. But then the 2% ozone, depending on our concentration, but the little bit of the ozone gas will quickly break down back into oxygen. And in the meantime, produce all these ozonides, these little molecules that have profound immune boosting properties.
So the O3 converts back into O2, but when it does that, it releases immune enhancing properties into the blood. I've heard ozone it also has like the antiviral, antibacterial properties or something like that.
Powerful antiviral, antioxidant, the entire, any microbe.
Yeah.
And then cancer. So powerful. Basically, these...
Yeah, I've heard that, but people even combine it with chemo to increase the cytotoxicity of the chemo or something like that.
Because they can't handle the oxidative stress, whereas normal cells can handle it. So we're killing them very effectively. And I've seen even the beginning of the COVID pandemic, there's one doctor who sent me a video of a person that just came down with COVID. and went through a 10-pass ozone treatment with him. And he showed this testimonial. With each pass, the person had reduction of symptoms. So by the end of 10 passes, the symptoms were gone. And she came in with raging headache and so it can be very powerful. So we can kill the microbes, in the process, but also it superoxygenates your blood and it activates the antioxidant system in your own body. So not just giving you antioxidants, which have its own drawbacks, but activating your own antioxidant system. That's very powerful.
So is it almost the idea that oxygen or ozone is a pro-oxidant and the response of my cells is to increase their production of antioxidants?
That could be, that could be one of the mechanisms. Yeah.
Okay.
Yeah. So, it also makes the red blood cells more pliable. So they're more flexible, so they can squeeze through blood vessels and deliver oxygen more effectively.
Okay.
So yeah, there are a lot of benefits that we are, utilizing. And,
would anybody ever say that ozone is dangerous or harmful? Do you get that sometimes? Because I mean, there's some people who all they know about ozone is the ozone layer or something like that, or you're not supposed to breathe ozone.
Yeah, that's, when the debris, that's not the kind of ozone that we're using. So people don't know our antibodies in the body, right? The proteins that's made to attack bacteria, virus, all the pathogens actually can secrete ozone. They can make ozone. So your body actually have the capability of generating
antibodies in your own body can produce O3.
Yes.
Interesting.
Yeah. So it's a naturally occurring substance. So we're just utilizing, again, this is part of regenerative medicine because we're utilizing what's in nature. What can come out of our body to heal our body.
Yeah.
Yeah.
Yeah. Wow.
So,
okay, so you do the hydration, and then you took out my blood, and you're going to ozonate the blood that you took out of me.
Yeah, exactly.
And then put that back in me.
Yeah.
Okay. And you do all of this before you do any type of stem cell procedure. Is that because it enhances the efficacy of the stem cells, or is this just stuff you do besides the stem cells to help the body feel better?
Well, just by the fact that it superoxygenates your body, and of course, it's antioxidant capabilities. It helps your body's overall health and helps your immune system to be more active. Active, not in a sense of overstimulating, but boosting it, when it's lowered. So, it's basically another way of enhancing your body's reparative mechanism.
Okay.
Yeah.
Okay.
So the reason I'm adding all these components is I always say, let's say I can give you stem cell treatment that can produce an effect at 70% of what the maximal possible recovery is. But if I can add ozone therapy that gives you 5 extra % of benefit, and I can add the laser therapy that can give you an extra 10%, right? All of a sudden, the benefit is much higher.
You're stacking. And are you primarily treating, because you mentioned, someone coma, you mentioned cancer. Are you mostly treating people who want to go from good to great, or do you work more with sick people?
I would say 90% of the people who come to us are very sick with all kinds of problems that they have gone through their providers, tried everything else. And so this is because it's not an inexpensive treatment. So they usually try other things first, whatever that's covered by insurance, whatever they can do on their own. But then things were not getting better.
When I walked in here, there was a guy named Eddie. He's still standing in the room right now, but he's holding a camera. You probably can't see him. He said he couldn't walk when he came in to see you. No, he obviously can because he's standing there. What'd you do?
So Eddie was given stem cells. Maybe we can just ask him to
get in here, Eddie. You're going to be on the podcast.
Essentially, I had an injury and basically just smashed the bottom of my feet, crushed them up. And I ended up having, I thought that I would, just like an athlete, you are. I think we're about the same age too. And I ended up just walking on them for a few days. Then I went to the hospital and they said, "Oh, you're clear." I got misdiagnosed. And then I thought, okay, well, I'm just going to be in pain for the rest of my life. I thought that for 9 months until I got the stem cells, and I got them from Joy's source, and that's how we met. And then she ended up 2 months later, I was able to go, like from 9 months and not being able to think I'd be able to go hiking or anything like that, I was able to go dancing and walking or, I guess whatever, the Burning Man across the whole entire playa. So that was, a mile and a half, 3 miles or something like that in a day. And it was so neat to know that it's something that was not available when we were kids growing up is now available. And yeah, cutting edge idea and kind of being the tip of the spear with this sort of thing. And my hope is that other people, the masses, can have it. Like my family members will be able to have it when it's available with insurance.
Okay, got it. Yeah, I have a few more questions about stem cells, but before that, you were talking about your story and how you were in psychiatry, and then you started to learn that there were things that went beyond medication. So where'd you go from that to stem cells?
So first of all, I wanted to do something to enhance my own health, right? I've always paid attention to my health, that this is our most important asset.
How old are you?
How am I now?
Yeah, I know that's a rude question.
No, it's absolutely not, because I advertise it everywhere because I'm very, very proud of it. I'm 53.
And you look like you're like 40, maybe, tops.
Yeah, thank you.
Yeah.
So
I'm not just blowing smoke. People are watching the video. I mean, you look incredible.
Thank you so much.
And are you using a lot of these things that you've discovered?
Everything I'm giving you, I'm using it myself.
Okay.
And as far as stem cells, I've been putting it in my body every 3 months for the last 8 years. So
3 months for the last 8 years.
I do believe
your own stem cells, or
the stem cells I'm giving.
And I want to talk about that later on. Why you use the type of stem cells you use, but so you just wanted to address your own issues initially.
I didn't really have many issues to address. What I wanted to, first of all, I heard from this girl who received treatment. She had rheumatoid arthritis, and she was telling me how anti-inflammatory it was. Even during the time she was getting infusion, the swelling was going down, and she was able to wear the ring that she hadn't been able to wear for 2 years. And not only that, she had this increasing energy and sex drive. So I thought, give me some of that.
Yeah. And she was doing stem cells.
Yes. So I thought, well, that sounds amazing, because she felt amazing. I just wanted to feel good, right? I wanted to feel really good for a very long time. I wasn't thinking about what it's going to do to how I look. I didn't really think about that. I just wanted to feel good. And the side effect of doing stem cell therapy on a regular basis is that my appearance started to be more and more rejuvenated, because I can show people pictures of when I was 43. That was 10 years ago, and I look a lot younger than that time.
And how long ago did you start all of this, from psychiatry to stem cells?
8 years.
Okay, so you've been using stem cells regularly for 8 years.
8, yeah.
Okay.
Yeah. So I did it based on, I guess, faith in science, because I've seen the research of what happens when animals were given regular IV stem cells. Basically, they have shown in multiple studies that the lifespan of animals are extended by 30%. And not just lifespan, it's the health span. These animals they have shinier fur, their spine is straighter, they're running around,
And this is with like a blood infusion of stem cells.
Exactly. They put in the animal's tail vein, which is like an IV infusion for animals. And
I don't have a tail, by the way, so you have to find somewhere else.
Well, that's your tail today.
Okay, my arm. Yeah, my arm tail.
And also the animals are having better cognition. They can run around the maze better. And then this is a more definitive evidence of the anti-aging benefits. They actually sacrificed some of the animals. They looked at their muscles. They dissected their brain. In both cases, the amount of growth factors secreted by the cells, the neurotransmitter level that they're able to produce, and senescent markers or toxic waste, everything was back to the younger state. So that was a level that they know is going to change over time, right? It should have either increase or decrease depending on the marker, but everything was back to the level when the animals were younger. So that's definitive evidence that physiologically these animals were reverted to the younger state.
Wow. So you find all this out. When did you hang up the hat on psychiatry and just decide you're going to go full on in the stem cell
Once
therapy?
I started doing stem cells, it was just so much fun. My first patient was actually a 69-year-old gentleman who had bilateral, a lot of knee problems. And he was told in no uncertain terms that he needed bilateral knee replacement by orthopedic surgeons. So he came to me. He didn't really want the operation. He's very active. He's a owner of a probiotic company who goes to a lot of trade shows. He's very active. So I gave him an IV infusion and I injected 1 cc into each knee. The fun part was the next day he told me, oh, I slept through the night. I haven't slept through the night for decades because he had a rotator cuff injury that he never told me about. Every night when he would turn, he would wake up from the sharp pain. So,
you didn't inject the rotator cuff.
I didn't know about it.
So a systemic infusion affected a bum joint.
That's right. That is a joint that bothered him for decades. And I fixed unintentionally. So, and then, of course, his knees did great because he was walking about 4 miles every day. This is 8 years ago.
Wow.
And he barely feels that he has knees. He said, this is just amazing. And he still goes to more trade shows than I know. So he's 77 years old now. Absolutely amazing. So that hooked me. Because imagine,
that was patient zero for you.
Yeah.
This guy.
Imagine I was a psychiatrist, right? We were told not even touch patients because that's not, is not proper. And for me to put an IV into somebody's body, and then inject into the knee, and then the cells kind of did its own thing. And then I was able to fix things that his orthopedic surgeons could not. And I was not trained in orthopedic surgery. And then I have all kinds of other patients, chronic pain patients, lady with lupus. I got her after the treatment. His lupus markers was basically shows that she has no lupus. So, and I'm not a rheumatologist. And I was treating people like MS, right? I'm not a neurologist, but I can give the person an IV infusion and the person goes MS remission, going back to work. Yeah. So all kinds of examples.
Yeah. So many applications.
It's empowering because it makes medicine really fun again. So that's what I want to show doctors, that this can be fun again. It's not depressing anymore.
Yeah, but we're in LA. Where we're a little bit. What's the name of this town? It's above Malibu.
This is in San Fernando Valley.
San Fernando Valley. Okay, so a lot of people go overseas. They'll go to Cabo or Tijuana or Dubai or wherever to do stem cells, but you do them here.
Yes.
And what a lot of people will say is, well, you can only get the good stuff out of the country. You can only get expanded stem cells with a higher stem cell count if you're outside the U.S. Why is it that you would set up shop here and not do something like expanded stem cells?
Only if those statements are actually true. So, first of all, the dose calculation is based on research. And research were using expanded cells. And they thought that you have to have certain amount to exert certain...
And we should probably define what it means to expand a cell.
Expand means to put cells in some kind of container with certain nutrients and then put them in an incubator to allow them to multiply so they can grow into huge numbers. So you can imagine if there's a small amount of stem cells and then you grow them to huge numbers and you take a little portion to give to patients. So, the cost is cut down dramatically. The problem is that when you multiply these cells, the common understanding is by 4th generation, there's a lot of deterioration. You really don't want to give people...
multiply a cell by 4 generations.
The 4 passages. Okay. Yeah, passages when they change containers.
Okay.
But even with 1 passage, there's evidence that there are genetic changes. And there probably is some kind of degradation.
Like a mutation?
Yeah.
Type of thing?
Yeah.
Interesting.
And also not just mutation, but also expression of surface markers. Because cells, the definition of stem cells is that they are capable of making copies, multiplying by making a copy of itself. And another copy is the more differentiated version because they want to replenish the tissue they're occupying, right? So they don't want to just stay being a blank cell.
Right.
They want to gain function.
Else.
So, but by doing that, when you multiply them in some kind of container, then their tendency is to reproduce into a copy of themselves and something that's more differentiated. That may no longer be a stem cell or have a more downstream kind of development of markers that is consistent with the donor, right? Mm-hmm. So now you're expressing surface proteins of the donor instead of being a blank cell that doesn't evoke an immune response. Now you're expressing proteins that can trigger an immune response. This is probably the most important reason why when people go overseas, they can have so much side effects.
Okay.
Because these expanded cells, like Tony Robbins was talking about the cytokine storm, that you should expect cytokine storm. I always say, I've never seen cytokine storm in this clinic.
I've had expanded stem cells before, and I have had times when I felt like crap from getting that. The issue, though, about it being partially caused by a donor stem cell, couldn't you skirt that by taking somebody's own stem cells, like some people do from fat or bone, and then expanding those? Or would they still mutate or something like that?
They would still mutate. But the problem is your own cells is your own age and carry the same burdens that any other cell has been exposed to. So because stem cells stays with you for your entire life, right? They've been with you since you were born.
Right.
So they collected all the
theoretically,
damages.
unless you had parents who were thinking way ahead and they harvested your stem cells when you were a baby.
Exactly.
And then you got those expanded and infused, then you run a lower risk of an immune response or a cytokine storm.
Yeah. When I first got into the stem cell field, I thought, oh my God, there are all these different sources. Which one should I use? Because I want to give people the best. Whichever is the best, that's what I'm going to do. I'm happy to learn about bone marrow extraction or fat extraction, but I just need to know which one is the best. So I started to dig into scientific literature to find out what people have found as far as the differences between these sources. And that's how my, lecture, it's called Are All MSCs Created Equal? How that came about, because I was giving direct evidence to show people what the differences are. And really, when you look at across the board, let's say we take stem cells from your fat or bone marrow versus from the umbilical cord. In every aspect, whether or not you're looking at anti-inflammatory actions or neuroprotective effects, or how many generations the cells have left and how wide their differentiation potentials are, and also just how long their telomeres are. They've looked at all these parameters. In every parameter, it shows that umbilical cord stem cells are way superior than the other stem cells.
And this, you're using umbilical stem cells.
Yeah.
And when you use umbilical stem cells, this issue with something like donor compatibility is not an issue because umbilical cells are kind of neutral.
Exactly.
And you don't get any of like mom's DNA or anything like that in the umbilical cells?
Not from the umbilical cord. If you use placental, the placental tissue is a combination of mother's cells and the baby cells. But if you use umbilical cord cells, it's only from the baby. So that is another reason that I prefer that. So some people will, will say, well, cells from the fat is highly protected. They're hibernating. So there's no effect on their viability or as far as toxic damage. And if you just use common sense, you can understand that that's probably not true, because I want you to think about your own sperm or someone's egg, right? Sperm and egg decline as we age, right? Those should be the most protected, the most precious resource in the human's body.
Which is why it could be riskier to say, like, have a child when you're later in life.
Exactly. So if your sperm and egg decline as you age, why wouldn't every other stem cell in your body decline, right? Nature would have done its very best to protect the sperm and egg, and it couldn't, because the toxic damage is everywhere to all your cells, including your stem cells. So as we age, our own stem cells number decline like falling off a cliff. When you were born, every 1 in 10,000 cells is MSC. So that's a mesenchymal stem cell. That's the hottest stem cell right now. But when you reach your teenage years, it's already become 1 in 100,000. So 1/10. And when you reach your 40s, that's 1 in 400,000. And when you reach your 80s, is 1 in 2 million. So you can see the cliff, how that falls off.
Yeah.
And that's why there's an acceleration of aging, right? 20s, you can't quite tell that you're aging. 30s, okay, I can see the signs. 40s, all of a sudden, 50s, right? You're dropping off a cliff. You look a lot different. And, everything is declining rapidly. You have fast accumulation of chronic illnesses because the decline, the inflammation has come to a point where all these diseases that's time for them to flourish, right? That's how they come on board. So you really want to prevent that kind of inflammatory and immune dysregulated state. And that's why stem cells can be so powerful at extending youth.
So when you're extending youth and you're doing these infusions every 3 months, you're literally just doing an umbilical stem cell infusion on a
simple
quarterly
IV
basis.
infusion.
Center of the IV, how long does it take?
The whole process, if we add the ozone therapy, probably about an hour and a half.
Wow.
Yeah.
Interesting. What do you think about all these new, like, sexy forms of stem cells people are talking about? Like, I heard Dr. John Lawrence down in Florida. He was talking about X cells. Dr. Adil Khan, who I've had on my podcast, he talks about these Muse cells, which he says have low issues as far as like their, the rejection of the immune response or the histocompatibility of them. Like, why is it that all these different forms of stem cells pop up that people seem to like latch onto and go with as the next new thing?
Yeah, I'm not too familiar with Muse cells, but I'm sure everyone is trying to find an edge to see what's the most effective. What I can say is there's definitely the tendency of decline when you use a person's own cells. So
when you use a person's own cells.
Yeah, even if you use
like you take their cells out and you store them, they'll decline.
Yes.
Yeah.
So that's been living with you throughout your lifetime.
Right.
Even with what people call V cells, right? That's another popular form.
Yeah, V cells.
People start to know, even that will decline with age. So as a person gets older, that treatment become less and less effective.
Okay, got it.
Yeah.
How do you know, because a lot of people get nervous about this, like whether if you go to a practitioner, whatever they're using, even if it's umbilical, are pure, like that they don't have, crap in them or toxins or anything like that? Is there some kind of purification process?
That comes to the issue of what I think makes a successful stem cell treatment. There are two aspects. One is the quality of the cells. Two is how you're putting it in the body. So both are very important. So when it comes to cell source, yes, first of all, you want the healthier, younger, more vibrant cells. Two, you want it to be extracted in the right way. And of course, different tissue banks will have different processes. Some are superior to others. Some will provide more viability after the cells are frozen and then thawed. And some will preserve more growth factors and different signals in the solution that the cells are suspended in. And of course, the screening process is important. The mother's health is important. She's eating all kinds of junk and bad oils. That's going to affect the quality of the cord. So each cord is different. Some are big and fat. Some are long and skinny.
Yeah.
I mean, they're all different. But finding somebody that's healthy, that's important, and young. We take donations from mothers who are younger than 30, and we also screen their health. And of course, we screen for family history, travel history, toxic exposure, work history, sexual history. So everything that could affect the cord, we screen for. So not every company will have the same stringent criteria, right? Some may compromise because they want a cord. But for the company, the lab I work with, there's no compromise.
Okay,
And
so you don't get the stem cells yourself, you get them from a lab, and that lab specializes in getting the right kind of stem cells and purifying them.
Exactly.
And screening
So
them.
from a FDA registered laboratory that adhere to the standard from the American Association of Tissue Banks, because the obtaining of tissue
So they're regulated by the FDA.
The FDA wants to regulate it because FDA, their purview is drug regulation. Mm-hmm. But when you do tissue transplant, that's actually governed by American Association of Tissue Banks. So, but the FDA really, really wants very badly to regulate this industry as drugs. They want to categorize it as drugs.
Categorize stem cells as drugs.
Yes. And I see a recent wave of control and wanting to put this category of therapy as giving drugs. Very obvious example is when I just recently read a warning letter to one of the tissue banks. One of the things that they were objecting to the scientist was that he mentioned in the podcast that he was getting cells from the Wharton's jelly and he was giving it to people to help with cartilage repair in the joint. So the FDA's letter said the umbilical cord is a conduit. The entire function of the cord serves as a conduit for the blood, right? For the artery and vein. So unless when you transplant it, into another person unless it's performing the function of a conduit. Then it's a drug. So go figure as far as the rationale. But what they think of a tissue transplant is that the cells has to be performing the exact same function from before transplantation to after transplantation. So that means effectively, if you take cells out of the umbilical cord, because we're no longer putting it back into an organ to make it a conduit, right? To help being a conduit. Then that makes everything a drug. So the question is, how do they know what the cells are there for? How do they know what the function is? They say it's a conduit, but we know the birth tissue has profound effects on the fetus. When the fetus is forming, the placental tissue and the cord is much bigger than the fetus. Because if it's just a conduit, you would think it will grow proportionally as the fetus grow, right? So the fetus will grow and the placenta grow. No, the placenta is big and the fetus is tiny. So there's a lot of instructions that's going into the fetus. We don't know exactly how it's working. So my question is, how are they, who gave them the authority to decide what these cells do? Because our science hasn't figured out yet.
Why would that even be a problem for it to be classified as a drug? Because you're a doctor and you can prescribe drugs, right?
Oh, we can't. But when they classify something as a drug, that means it has to go through the drug study. So that's where the kicker
so then
is.
You got like 10 years of research.
You have to apply for investigation of a new drug application. You have to go through animal studies, then phase 1, phase 2, phase 3, and it's very costly. In general, just so you know, on average, to take any molecule, any discovery from discovery to market, that process costs about $2.1 billion. And nobody has that kind of money unless you're a big drug company. Just so you're aware. And I've heard already of tissue banks going bankrupt, trying to do these studies the FDA is requiring. So that's where the problem's at.
The FDA has also been cracking down on peptides, it seems like.
Yeah.
Do you use peptides in your practice?
Yeah. And we're actually going to give you some peptides as well.
What do you primarily like peptides for?
I love how it's able to help me to target specific issues. Like we're going to give you BPC 157, TB 500. I love those two in combination with stem cells because they have this multitude of benefits. So they can target your brain health, your immune health, your musculoskeletal repair, also cardiovascular health. So all of a sudden, we're targeting multiple organs. So I like
do you do those as an infusion, or you inject them like subcutaneously, like a lot of people
we
do
give it to you both. So that's what we do for our patients. We do infuse it, and then we give you some for take-home injection.
Are there other peptides that are kind of favorites of yours in your practice?
Yeah. So the growth hormone peptides, the BPC the CJC 1295 and ipamorelin or tesamorelin, those are great, right? Building muscle mass, reducing fat, and of course, regenerating, repair, and great for brain as well. And P alpha 1, great for autoimmune conditions, helping with boosting immune system. I also like certain brain peptides like C-Link, great for anxiety. There are other ones for depression and cognition. CMAX, great for cognitive repair.
Are these kind of like one-offs, or like for you, for example, would you just use peptides regularly like you would like a supplement, like a multivitamin?
Yeah, because as we age, the levels decline. So if I can replenish some of the signals, I mean, there are 300,000 different peptides in the body. We've only discovered 7,000. But if I can, I know some important ones, I can just add those in. It's going to have profound effects. Another favorite of mine is called Apitelon, and you probably have taken it. It's great for cardiovascular rejuvenation, but it can also lengthen telomeres. You only need to do it once every 6 months for 15 days at a time. And they actually had a study where people were taking it at 6 rounds. So 15 days, 6 times. So in 3 years. And then they followed them for 10 years. At the end of the 10 years, that people got the Epitelon treatment for those 3 years, their cardiovascular system was 9 years younger than people that never got it. Wow. And the rate of cardiovascular mortality, death from cardiovascular disease, went from 83% to 47%.
Yeah. On cardiovascular health. Wow. With the peptides, as far as like the FDA's crackdown or whatever on those, has that affected you? Like, is it more and more difficult to get your hands on them?
It is more difficult. It's a pain in the butt. So I'm not enjoying how things are more difficult. Yeah. So, it's unfortunate.
What about the peptide bioregulators? Like, you hear about a lot of this Russian research on longevity.
Those are hard to get as well.
Target specific organs or something like that.
I think that's fantastic. But I think one easy way of getting those are just eating organ meat. Taking.
I've heard that before. Yeah, that's certain. That gets like the supports type of thing. Like if you have liver, it's good for the liver.
Yeah, it's really strange. I used to think it was a superstition because in Chinese culture, they were eating things that they think is going to supplement a particular organ. They were eating those organs. I thought that those were, superstition. But now we have actually scientific support.
Is it like amino acid tracer studies on them or something like that? It's crazy. They actually wind up in the target organ.
Yeah.
This is fascinating.
Yeah.
And what about exosomes?
Yeah.
These days?
We like exosomes here for sure. And I use that strategically along with stem cells. I almost never use them by themselves. Sometimes, it may be appropriate like for skin, hair, maybe for joint injections if someone really prefers. But I always like having stem cells on board because I always say the stem cells are the mothers of exosomes because that's what produces the exosomes, right? MSCs produce a lot of exosomes. A lot of companies provide exosome products that came from growing the mesenchymal stem cells, MSCs, and they keep spewing out these exosomes. So the issue of putting just exosomes in the body, the benefit is that you have a lot of them. And it's very anti-inflammatory. It can go to all your tissues, can produce a lot of benefits, but they're very short-lived. So they don't last very long. Once they're in the body, they dissipate pretty rapidly. But their effect can last for generally between 1 to 3 months. Mm-hmm. But if you put the cells in the body, the cells can live in your body for 1 to 3 months. And in the meantime, they will travel to where they're needed. They have the ability to sense where they're attracted to, right? All the inflammation and injury. So they will get to those areas. And once they're in those areas, they're going to secrete exosomes that are actually relevant. So it's almost like a smart pharmacy, right? You're sending this intelligent entity into the body and they find it and then they give you exactly what you need. So instead of blindly sending out, making all these exosomes, they're giving you exosomes that actually is targeted. Yeah. So I like that.
But you still use the laser to target as well.
The laser is more for directing the cells.
Okay.
Yeah.
What's the difference between directing the cells and targeting them?
First of all, the lasers can make the cells more mobile. And what's fascinating is there's one study, I think it's mice, they induced heart attack. I don't like those kind of animal studies, but it kind of instruct us on what's going on. So they induced heart attack.
Yeah. I'd rather mice be having a heart attack than humans. So.
Yeah.
Although I wish they could do it on fruit flies. That'd be even better.
I don't know. I don't know if there are other ways. Maybe they can just, I don't know. They can just do it on humans with heart attack. But anyhow, they can shine light they just shine light on tibia, on their leg. Mm-hmm. And then what happened was that and then later on they sacrificed them. The mice that got light shining on their leg versus the one that didn't get light shine on them, when they look at their heart, the amount of stem cell density in the heart of mice that got the real laser, the density is 25 times as much as the one that didn't receive any laser treatment.
And was the laser directed on the heart area?
The laser activated these cells and made them more mobile.
Okay.
So they're a lot more mobile.
So you didn't even have to expose the heart to the laser. You had to expose the cells.
Exactly.
To the laser.
So we're activating intelligence almost, making them, either intelligence or just making them more energetic. But there's a whole process of the photobiomodulation I think is more profound than what we think, because a lot of times we talk about mitochondria. I think it does a lot more than that. We just don't understand yet. So light is very powerful. We're going to get into the stage of energy medicine. I mean, we're just at the beginning, but incorporating energy medicine, I think is very important. So they can activate the cells. But in the meantime, if I want to target certain organs, we can put the light more concentrated, in a more concentrated manner at different organs while the stem cells are circulating.
So this laser that's like just sitting beside me right now, it's on. Obviously, there's lights. Is this just kind of like doing the thing where it's shining on me and any stem cells
there are different settings. There are different settings depending. So we do there's a pre-stem cell setting actually. So there are different wavelengths. Wavelengths is the same, but different frequencies. So it's almost like talking to cells. Different organs, different cells respond to different frequencies. So it's almost like programming a language. So there are 4 numbers, and we're programming exactly.
So this is on I'm not getting stem cells right now, am I? This is Ozone. So this is on like a pre-stem cell frequency.
That's right.
Does it go through my clothes and everything?
Yes, it can. It's probably that you're going to get more of the light without clothes, but black is actually the better ones as far as what you're wearing to allow laser penetration. But we have other settings. There are hundreds of settings. Some are great for brain health. Some are great for immune health, for gut repair, for, any kind of joint repair. So lots of different settings, talking with different tissues. So all these are based on research and clinical experience of what has been helping. Yeah, it's pretty fascinating. So it's like this machine has its own language.
It's crazy. And you also do addiction.
Yeah, I don't do that very much anymore, but we have the problem. So coming back to the story of why I transitioned from psychiatry to anti-aging and stem cell therapy is because psychiatry is not addressing the root causes. Let's say I'm treating someone with depression, but I'm not evaluating the person if the person is getting proper nutrition. Is the person's hormone really optimized? Is the person toxic from some substance? Is the microbiome balanced? We're not looking at any of those. We just start throwing drugs because that's what we're taught to do. Either in medical school or residency, we are drug focused. So it's all about drugs. We want to diagnose people very badly because we want to connect them with a drug. Without a diagnosis, we can't justify giving anybody drugs. So the diagnosis will allow us to write a prescription, and that was, where our pride is at, right? We can prescribe you medication to alleviate suffering. Unfortunately, those medications, almost all of them are not addressing the root cause. Temporarily, I'm not saying they're not useful. I think for emergency use, they can be life-saving and powerful, but that is not the long-term solution. So even for something like addiction, I was a medical director at a few rehab centers in Malibu. So I saw firsthand how things were done. Unfortunately, we are still using the drug model. So even if I try to be integrative, I try to address the root causes. Let me send you, some labs. I want to test your hormones and your nutrition, and let's see what kind of supplement we can give you to augment, boost your own system or repair your brain. By the time I'm giving them supplements, a lot of these patients in the rehab, people in the rehab, were telling me, hey, doc, my insurance is not covering the supplement. So can you just write me a drug? So that was very disheartening, right? I did all this work.
When they say just write me a drug, what kind of drugs are we talking about?
Antidepressants, antipsychotic.
These are the things you would use for addiction.
Yes. Okay. Yeah, those are the bread and butter. So the problem is that we're not addressing the root causes. What I believe the future of medicine is that everybody is going to be practicing anti-aging medicine. You can call it anti-aging medicine or integrative medicine or functional medicine or even naturopathic medicine. They're all about the same, which is looking at the body as a very complex entity, that everything is affecting each other. And there are common denominators. So nutrients is one of the common denominators that affects everything, multi-organs. The microbiome affects multiple organs. Right? Hormones, multiple organs. You're looking at what can affect all these things and how they're all connected. So that should be taught in all medical schools across the board. Whatever specialty you're going to, you've got to be fluent in this integrated medicine language. So you want to address all that first. And then you use your specialty knowledge to do things maybe you have other methods of treating a particular problem. Maybe some people need surgery. Maybe some people need some kind of heavy duty drugs, maybe. But you want to fix all the foundations first, not to mention you're improving the health of all these people overall. And whatever other intervention you're doing in your specialty, people are going to do better because their overall health is elevated.
I've seen NAD used in addiction clinics before. Do you use NAD?
Yeah, we do NAD here. Yeah, but we also use ketamine treatments, which is, I'm very much a proponent because I think it's a
ketamine
powerful
infusions.
IV treatment. So ketamine is FDA approved for treatment-resistant depression, and it's pretty powerful as far as lifting people out of depression very rapidly. The only thing that can do something so rapidly is the shock therapy, the ECT.
Okay, electroshock therapy.
Yeah.
How often or how many times does someone need to do a ketamine IV to tackle an addiction problem?
Well, the general recommendation for ketamine therapy to strengthen the new neural rewiring is 6 sessions in the first 2 to 3 weeks.
Okay.
So that's the first block of treatment. So you get into a new pattern because it increases your brain-derived neurotropic factor so drastically.
Ketamine does?
Yeah, it does.
Interesting.
New synapses is all shown. It's amazing. For PTSD, it's absolutely, powerful. I'm not going to be able to help somebody with PTSD using stem cells. No matter how much stem cells I give them, it's going to be very difficult to change the wiring of the brain. So that requires a whole other way of addressing our health, because I think it taps into something that's way beyond just the chemistry. I think that goes into the whole quantum level, and that's a whole other conversation. And so metaphysics at this point is still kind of a forbidden subject in medicine. That's not considered to be scientific. And it's simply because science doesn't have a language for it. So one day it's going to be incorporated into the science of
quantum healing
the language
concepts.
Of science. Yeah.
God forbid you pray over a patient or send positive energies their way.
Oh,
or
yeah.
like that.
That's, keep it to yourself.
Yeah. You mentioned nutrition. Knowing what you know, I'm just curious, what kind of diet do you eat?
I try to, everybody's different, of course. I found out that, first of all, high blood sugar is not good for anybody. Blood sugar spikes is not good for anybody. But me in particular, as I found out later on from the CGM, right, continuous glucose monitor, is that my blood sugar responds to something like rice or any carbohydrates very drastically and not very good, because it spikes my blood sugar.
Carbohydrates.
Yeah.
Okay.
So I try to eat a low carbohydrate diet. And if I do eat carbohydrates, then it's going to be more complex carbohydrates. Yeah. In whole grain.
Yeah.
Carbs.
And are there certain things like certain superfoods or supplements that you think are really good when it comes to especially the longevity or the anti-aging component?
Yeah, there's so many. It's so crazy these days. And it's, there's some that I think are great, like AFA, the blue-green algae I do take, and resveratrol. Sometimes I take. I'm not very good. I've been super consistent, but mushrooms, I'm a big fan of different types of mushrooms. Very powerful.
Have you heard of Dr. Sandra Kaufman before? She has this whole book called The Kaufman Protocol, and she prioritizes all these different supplements and nutrients specifically for longevity effects. And she has a whole like a table that shows their ranking. And I recently interviewed her. I think she said that the top one, I think it might have been astaxanthin, was like at the top of the totem pole. Curcumin was way up there. Okay. There's one other I hadn't heard of before.
Are you taking
all those? Go back and check her book. Not regularly. No, I mean, like I'll take certain cocktails of stuff. Like you talked about that stem regen, for example. Yeah. I think that's just a cocktail of a bunch of those type of things, right?
Yeah. I think about 5 different herbs.
Yeah. And you use that with your patients to help prepare their body for stem cell infusions?
Again, if I can give them a little edge with the treatment, because I don't really care that I don't know what's doing what. I just want people to do better. And because I know how these things can enhance the body, I just want people to get everything so they can get a lot of, the maximum benefits.
And there's so many, exercise modalities associated with longevity too. Grip strength or VO2 max or lactate tolerance or any of these things. Do you prescribe certain exercise protocols, or do you favor a certain approach to exercise? I think that you need a balance between strength training and cardiovascular training. So it would be good if a person can do something that incorporates both.
At one point I was only doing Zumba dance. So that's more cardiovascular. So another point I was only doing Pilates, which is more resistance and the strength training.
Zumba is very cardiovascular for me, by
the
way.
I'm
not very, graceful on the dance floor. Not very inefficient at Zumba.
What's interesting, I think people are of better shape in my Pilates class than people in the Zumba class. So you see all these women, we were all dancing together, but I see so many, most of them are overweight and they're all dancing like crazy. They were all, really sweating and doing the best they can. And they may do it a few times a week. So it's curious, why are they still so overweight? I think one is poor nutrition. They're putting things in their body that's preventing them from actually having an efficient metabolism. The other one, not enough weight training and strength training.
Yeah.
Yeah. So
probably a little bit of self-selection there as well. I think probably the demographic that would frequent Pilates might just be generally more aware of fitness, nutrition, etc. than the person who signs up for the dance class. Yeah. Maybe I might be stereotyping.
And it's even better in hot yoga. So now I've incorporated hot yoga, which is a little bit more cardiovascular, more stretching. And so that's, I think, I found a nice balance.
Yeah.
Yeah.
Yeah. I heard the person who introduced us was actually a former podcast guest of mine, Dave Pasco.
Oh, okay.
And he told me a few days ago that you wrote a book.
Yes.
Tell me about that.
Oh, okay. Yeah, it's called Tiger of Beijing. So it's a memoir, but not the typical memoir of what people are thinking about. So that's the...
Is that you on the cover?
That's me.
Wow. So how long ago did you write this?
Probably about 4 years ago, maybe close to 5. Yeah. So this is only about 3 years of my life. But
3 years. This book is 3 years of your life.
Yeah, from age 20 to 22. Yeah.
So this is not about health and medicine per se.
No.
Okay.
I was going to write this book as a novel because it's such a good story. Chapter 1, it starts with my visa rejection in Beijing, standing in front of the Beijing American embassy.
So you were trying to come to America from China and get a visa to do so.
Yeah, I was an architecture student in college, but I wanted to come to America, so I kind of had to switch major in order to get scholarships. And I did everything possible, 18 months of hard work, and I got a scholarship to Clark University. I was excited. My parents, I didn't have much clothes. I didn't have a suitcase. We're going to buy everything after I get my visa, and I got rejected. Because the man behind the counter did not believe the person that was doing the affidavit of support, who was my mom's student, he would actually be willing to help me. So he didn't believe it. But if I had known a real American instead of a Chinese person, a real person, American, or someone that's actually a relative, then I may have been approved. So it's nothing to do with my merit. It's because they didn't like who was sponsoring
your
me.
Affidavit was.
Yeah. So
sponsor.
So I was, so the book, really, the story started with that rejection and my anger because of that. The anger kind of fueled me to seek a way out of that. And if you just think about it, here's a young girl with no money, no connections, but just a desire to go to another country. Two of the most powerful governments in the world are making it very difficult. So the Chinese government did not make it easy, and the American just said no. So I had to find a way to know an American, find somebody to sponsor me. So that's when I went on a little bit of unconventional adventure to actually know an American person who actually can help me.
You didn't know anybody who was American at the time? Wow.
Not really.
Wow.
Yeah, I had to find a way. So I did something that's very unconventional. I took the yellow pages of Beijing. I just got
like
this.
The phone book, Yellow Pages?
Yeah, the phone book.
Okay.
So I just flipped through.
Our young listeners might not know what that is. But
the phone book. Oh, that's I haven't even thought about that.
Or you look up phone numbers.
Yeah. So,
back in caveman times.
It's like I was shooting in the dark, right? I was shooting darts in the dark. I was like, I'm just going to call. I don't know anybody. So how about I just know somebody? So I took the Yellow Pages and I took phone book and flipped to the part of all the big hotels in Beijing. And I just started to call different rooms randomly. So I talked about, I met some creeps. But then I also ended up, in a very circuitous way, I became a tour guide to Tibet. So there's a huge adventure.
And that was how you met Americans.
Yes.
Oh,
So it's a very interesting story. But that was good that I met American, ended up coming to San Francisco.
Yeah.
That's only half the story. And then it turns out that it was a tough situation for me, as a young woman trying to navigate all these, basically a relationship that was actually not good. There was a lot of manipulation, a lot of control. It was a difficult thing for a young person or for anybody to navigate, not to mention an inexperienced young person in a relationship. So I ended up having to escape that situation because it got very toxic. So I talked about me ending up literally escaping. So that was the story, but triumphing eventually.
Wow.
Yeah.
And I'm assuming after that then you got into medicine.
Yeah. So after that, I got into, the book kind of ended with me giving a valedictorian speech at San Francisco State. So going from me thinking I was going to be homeless on the streets of San Francisco to actually giving a speech to 10,000 people.
Wow.
Yeah. And
incredible. So the book again is called The Tiger of Beijing. Cool. Tiger of Beijing. I will link to this in the show notes. If you go to bengreenfieldlife.com/joykong, as well as everything else that we talked about. But Joy, how do people find you? How do people actually try out some of these protocols that we're doing today or some of these other techniques that you have here?
The best place to find me will be drjoykong.com. So that has everything I'm doing. So not only I have my clinic where we do a lot of, therapies, but I also have a stem cell company that I developed a formulation of a stem cell product that actually combine different components from the umbilical cord. So instead of almost all companies out there, all tissue banks, they only focus on one segment of the cord, cord blood or cord tissue or amniotic membrane. They're all good. But when you combine them together, it's more powerful because all these cells have different properties, have different differentiation potentials and different growth factor profiles. So I think I'm the only one in the industry actually developed something that brought all of them together. And so that's a product that we're sending to doctors all around the country. And so that's one sector. And then I also founded the Academy, American Academy of Integrative Cell Therapy, where we do physician training. And that's where, we have pioneering spirits. It takes some balls to actually do stem cells because it's not FDA approved. So I love the group of people who are willing to take this on.
Wow.
And then I developed a skin cream called Chara Omni. And
Chara Omni?
Yeah.
And what's that?
That's a 100% natural skin cream that contains umbilical cord stem cells. And
like the world's most expensive skin cream.
Yeah, so these are two formulations. One is just a regular.
Actually has umbilical stem cells in it?
Yes, they're not alive.
Legal?
They're not alive.
So, wow. Wharton's jelly extract. Wow, amniotic matrix. Jeez. Wow.
Yeah. And then a lot of peptides.
Yeah.
And all kinds of herbal extracts and antioxidants.
That was the Chara peptide blend. So that these are some of the peptides that are
So if people are interested, they can always go to charaomni.com. It has all the ingredients.
Wow.
But the reason I developed them was because I wanted to have a 100% natural cream for myself. Yeah. And it's very difficult to find. And the ones that I found ended up not being stable, not being shelf stable. So it's like, it's too new. And then the people who are doing it are not really able to make a good product. So then I realized I have access to stem cells and to peptides. So I can formulate something that's actually 100% natural. Yeah. Even the preservatives are natural. Wow. So I'm sacrificing some shelf life for 100%.
So for those who have always jumped up putting stem cells on your face,
this is the only thing I'm willing to put on my face for the last 5 years.
5 years. Wow.
Yeah.
It's working.
Thank you.
So I will, so you said your website is drjoykong.com.
Yes.
Dr. Joy, like drjoykong.com.
Yeah. Or joykongmd.com.
Yeah. And if you're listening, you go to the show notes. Those are going to be at bengreenfieldlife.com/joykong, KONG. Joy, this is fascinating.
Yeah.
You're doing very interesting work. So
thank you so much. It's been a pleasure. And we're almost done with the ozone portion.
My blood, my
Yeah.
vampire transfer. Awesome.
You reddened blood.
Cool. It is kind of different color if the ozone hits it, huh?
Yeah.
Wow. Awesome. Cool.
And then here, these are gifts to you. So
Oh my gosh.